wall has been removed and set back in. See that? And these plates keep it together. Here...
Wait, where are the plates?
Tiny little plates.
Oh, okay.
Now here, there's two ways in which the female skull is different from a male skull. At the level of the orbit, you have bigger orbits for female skulls than in male skulls. So we made actually orbits bigger. This here shows that extensive bone has been removed on the side. And the remaining bone has been thinned down. So not only the orbits are bigger in girls, but the bone that is above the orbit, above the eye socket, is thinner. So we thin that down. So according to the anthropological studies, that is. You can see the profile here is perfectly smooth. See that?
I know.
And I don't have a side-by-side, but I'll send you a collage of
Please
the
do.
scans.
Please do.
Now, looking at, and this has been taken all the way down to the cheekbone bone. This is the limit between the frontal bone and the cheekbone. And we did all that work all the way down. Now on the mandible side, you can see the angles have been cut.
Oh, wow.
On this side and on this side. And they actually are cut at a skived angle. So not only we cut them, but we also decrease the thickness of the bone. So the cut is not this way, but it's like that. So it removes also thickness of the bone. And here we refine the chin by reducing a middle portion, and then the two inner portions, two lateral portions, are brought in to meet in the middle. And
so okay, wait, you cut right here and then you brought this in?
Yes. So these two, there's two triangles that meet right in the middle, and this is the plate holding them together.
That's super awesome.
And that's about it. And then see, it's taken care of in terms of step off, so there's no significant step off. And all these crevices of bone that you see, the bone is going to fill them with time. It's going to heal. Same goes to the forehead. So that's about it.
That's about it. That's
Yeah.
a lot.
So I'll make nice collages and show them to you.
And okay, so with the scalp advancement, can you explain what you did there?
So with the scalp advancement, basically what we do is we develop the scalp flap all the way to the back here. We mobilize it and we move it forward, and that gives us about from 1 to 2 inches of advancement.
So you made incisions here, and then
we made the incision along the hairline, and then the incision transitions in the hair on both sides, to reach right above the ear, and then this flap gets developed off the bone, taken off the bone, and advanced forward. This one gets advanced up, and from the overlap of the two, we remove the forehead skin, and that's your scalp advancement. That's your hairline advancement.
What about the eyebrow lift?
That happens along with the scalp advancement.
Because they meet in the middle. It's super cool.
What about the nose? Can you?
Well, with the nose, essentially, we created a scoop where there was a hump, and then the tip, we turned it up and we brought it in, so it's not sticking out so much as it was before.
I love it.
Yeah.
I love it.
And,
It's amazing.
And the lip lift actually helped us reduce the size of the nostrils along with lifting the lips. So all these procedures are interconnected. Like one brings the other and augments the other.
You also put skin in. Can you explain like the lip augmentation a little bit?
So for that, we use some of the skin that we remove from elsewhere. We clean it up, so to speak, and we create tunnels in the lips, the upper and the lower lip, and increase their volume. And that's it.
That's so cool.
It's amazing. I'm so happy.
Yeah, you did well.